Need to optimize things for the individual in some vague public good. We're not going to have the public good because the public is made up of individuals.
This is true, and this is really the big difference between a totalitarian government, such as the National Socialist, who said the individual really has to be subservient to the state. Individuals don't count. It's only the state as a whole that counts.
You had a very good information sheet about mandatory vaccines at your website, AAPS. And one of the things that I thought was interesting, it was a bullet list of facts. 42 states have mandatory vaccine policies, you say, and many children are required to have 22 shots by the first grade. That's absolutely amazing. So we've already got mandatory vaccination. They're just trying to push this to another level of public awareness, I believe, because I think once we have some outbreak of a very serious disease like Ebola, it's very likely that they may force people to take vaccines that they haven't even pretended that they've tested.
Well, this is a prospect that a lot of people are afraid of. It's it's really it's really appalling to me that the vaccine safety studies are so limited and that people want to just completely disregard the vaccine adverse event reporting system, which is probably, if anything, underreports, even though the reports are themselves not confirmed, that a lot of bad things happen to people who take vaccines. And public health officials may assert that the benefit is far outweighs the risk. Well, I'm not so sure that's true. If you don't know exactly what the risk is, then how can you say that?
Speak to the one of the facts that you had here. You said that on the physician's desk reference, they say that there's only a 1% chance of adverse reactions to a hepatitis B vaccination, and yet you extrapolate that out with 70 million patients. That's a large number of people who are going to have an adverse reaction, isn't it?
Well, 1% is a really, really high rate. Now, if we're talking about environmental things or the EPA, they would say that even for occupational risks, the risk should be less than 1 in 10,000. Hey, this is a risk of 1 in 100. And for mandatory risks that the population has to just accept, they're talking about 1 in 1 million.
Yes.
So vaccine risks are much higher than that. And people do sometimes die of the vaccines. And you can say, well, maybe it was a coincidence. They would have died anyway. But if you can't find any other really good cause for it, and it happens right close to the vaccine, what is the logical conclusion to draw?
You know, it's interesting that you mentioned the EPA and the fact that they have a very different set of standards for environmental exposure versus exposure to adverse effects from these pharmaceutical drugs. I was just talking this last week to Dr. Dunn with an organization that has been looking at EPA testing on humans. And as they're pointing out, this is violating the Nuremberg Code according to the EPA's own data. They're exposing people to fine particulate matter that is 70 times higher than what they've said is allowed. And they have said in congressional testimony, Lisa Jackson, director of the EPA, said that the levels that she was talking about would not just make you sick, it would kill you. Nevertheless, the EPA is exposing people to 70 times that amount. This organization that Dr. Dunn was speaking for had tried to get an injunction to stop this, but the judges so far have not stopped this. So we've seen these experiments going on in North Carolina, in California. Now back in North Carolina, they are specifically looking for black teenagers who suffer from asthma, and they are hooking them up directly to diesel exhaust pipes. Can you believe that?
It's pretty hard to believe, in the medical schools in which this is occurring are accepting it. I think the EPA knows very well that it is lying about the effects of these particulate matter. So either they're just lying to Congress and imposing all these billions of dollars worth of regulations on us on what they know are lies, or they are deliberately exposing these people
Exactly.
to things that will harm them and maybe even kill them.
It's either one or the other. But the thing I find very dangerous, Dr. Orient, is that by the medical schools, the medical oversight committees within the state, the federal court system, and the EPA bureaucracy, by them all saying, we've set these levels up, and yet we're going to expose people to these levels that should kill them. Even if that's not true, even if those levels are not true, what they've done is they've established a legal precedent that is in violation of the Nuremberg Code and should trouble us all, especially when we see them pushing for mandatory vaccines.
Exactly. And the whole purpose of these experiments is to hurt somebody. That's why they're doing it. They're
Yes,
trying to find a toxic effect. In fact, ethical experiments are for the purpose of helping people, not of demonstrating a harm.
that's right. And as they pointed out, you can never get informed consent for something that is going to cause somebody a great deal of harm. One of the other things I wanted to talk to you about was you had a FOIA request in April of 2012 that you sent to the CDC asking for information about vaccines. I thought it had some very, very strong points. There were 12 points in there. We don't have time to go over all of them. One of them, the very first one that you asked for, you wanted documents and emails that would describe conflicts of interest in any members of any committee that recommended a vaccine. That's one of the key things that people aren't looking at is not only the conflict of interest within the medical community, within the CDC, who's supposedly overseeing this as an independent, not involved third party that is basically referee in this, but we also have a fundamental conflict of interest in the media because they are so heavily funded by the pharmaceutical industries. Did you get any information or any answers on that FOIA request?
No, we have gotten nothing whatsoever. They have stonewalled us, just as they did a couple decades ago when we sent a request asking for information about the safety studies of using hepatitis B vaccine in newborns.
Mm.
No reply at all. I suppose to get a response to a FOIA, even though they're required by law to give it, you have to go to court to sue them, and we haven't undertaken to do that yet. It's very expensive, and in the long run, you might not get the information anyway.
Yeah, we have to. That's the thing about freedom of information requests. You have to rely on the fact that they've given you all the documents that they have, and we have no way of knowing that because everything our government does anymore is kept as a closely guarded secret from the public. Let me read some of the other questions that you had because I think this really speaks to the issue of informed. They say they don't want our consent, but they're not informing us. You asked, what is the duration of protection by vaccines? What studies have you done on that? You asked, what is the safety and efficacy testing of the influenza vaccine? Describe any testing of thimerosal and other vaccine components for potential adjuvant effects. Where's the information on that? Do we have that information that we can give to our patients? We don't, do we?
As far as I know, we don't. I don't think it has turned up on any literature searches. And so the source of it would be the CDC. Did they check into it? Does it exist or doesn't it?
And
Maybe it
see,
exists and just hasn't been published yet, but I can't find it.
and that's the thing. Even though they will list side effects on the pharmaceutical inserts, not just vaccines, but all of them, they don't, in most cases, give you an idea of what the risk percentage is so that you can evaluate it yourself. They're just throwing these numbers out. We see them talking about how the efficacy of their vaccine is 99%, and they say that as they're talking about the number of people who were vaccinated twice who still came down with measles. In that particular instance, in this Disneyland outbreak, they've had 14% of the people who were vaccinated. In the incident the previous year, they had 18% of the people in a measles outbreak were vaccinated, yet they continue to tell us that it's 99% effective. And prior to that, Dr. Orient, back in 2011, I'm sure you're aware, in New York, they had a measles outbreak there that began with a twice vaccinated person. She was patient zero, the index patient, and she was able to transmit that to 4 other people who had also been vaccinated. 2 of them had records that they'd been vaccinated twice. So they want to tell us that you can't actually get a real case of measles and you can't actually transfer that to other people. And yet in the science literature, in Science Magazine, they point out the reason she was able to spread it to so many people was because they believed that it was not contagious, even if she came down with it as a vaccinated patient.
That is an astonishing case, and it's not something the media obviously is talking about.
Yeah, yeah, it absolutely is. And I guess we continually hear that the science is settled, and yet if they haven't done any studies and they don't have any figures on the safety and the efficacy of the influenza vaccine, on the duration of protection, on the effects of thimerosal and other issues, and of course they did have a paper that was published on the effects of thimerosal about, I think it was in 2002, and that eventually showed up. Dr. Hooker found that and exposed that. So for that paper to be put into, be part of a proceeding, it had to have the approval and the knowledge of the people at the top of the CDC, and yet they say that they haven't really found any connection with thimerosal or vaccines. Perhaps it's because in most cases they're not looking, but they did look at least in one particular case.
Well, certainly if you don't look for it, you're not going to find it. And if you do happen to see it, then they may tell the physicians to shut up because the science is settled and we're going to ruin you. I mean, they won't say that outright, but that has happened if you want to speak out against it.
I guess what troubles me is the cheerleading that is going on, and for many on the left, many people, ironically, I would say, would call themselves pro-choice on abortion, and yet when it comes to vaccinating your children, they just say, "Shut up and get your damn kids vaccinated." That's what we hear over and over again from them. We've had the L.A. Times is pushing the end of exemptions in California very hard. The editorial piece that came out last week. The title was "California Moves to End Personal Belief Exemptions for Vaccinations at Last." That was the op-ed piece. And I have to tell you, Dr. Orient, when they covered Jerry Brown, they say he preserved religious exemptions to state vaccinations back in 2012, but now he is open to legislation that would eliminate everything but medical exemptions. The LA Times then talks about the governor's new flexibility. Flexibility when you mandate stuff.
Exactly. And they're really turning these parents into pariahs. They're shunning them. They're confronting signs in the physician's office that if your child isn't vaccinated, I'm not going to see them because they are they are endangering the other patients in my waiting room. Michael Reagan called children who are unvaccinated typhoid Marys,
Really?
as if you could get measles from somebody who didn't have measles. I mean, just being unvaccinated doesn't mean you have the disease. It
Yes.
just means maybe you're going to catch it more than other people if you get exposed to it.
And the
But as
idea being that they're trying to sell us is that a vaccinated person cannot transmit the measles. They may have, according to the insert, measles-like symptoms, but they cannot transmit that. And yet we saw that happen in 2011. In that case in New York, we saw that happen. I'm very disappointed to hear that he's jumped on the bandwagon as well, but he perhaps may have a lot of pharmaceutical sponsors. I don't know. That's the other part of the problem, is the conflict of interest in the media. The media has jumped all over this. And of course, Megyn Kelly, who was excoriated by the left for last year for saying that everybody knew that Santa Claus was white, and she should have been excoriated for that. But nevertheless, they're now applauding her because she says sometimes you need Big Brother, and this is a time when we need to have Big Brother. Talk to us about this whole idea of herd immunity and the idea that you can somehow have herd immunity even if the vaccine can't provide immunity to individuals.
well, of course, they're constantly talking about this and sort of assuming that you're stupid if you suggest something that maybe vaccines are not all that they're cracked up to be. Uh, it's offensive that it's a veterinary concept anyway, and I've seen different estimates as to the percentages of vaccinated people that you need in order for it to have an effect. The concept, of course, is a good one that if the virus runs into people who are not susceptible, then it kind of has a dead end for being transmitted among the population. How many does that take? Maybe 70%, maybe 90%, maybe 95%. Well, 91% of American children are vaccinated with MMR, except in some pockets where they have a lot of exemptors. But we have this huge adult population that is probably still susceptible. And so we may not have any herd immunity at all for
Yeah.
measles. And we've only been protected because we have managed to keep new cases from entering the country, or we have, when they happen, we isolate them and cut off the transmission that way.
Back in the 1960s, early 1960s, before they had a measles vaccine, according to the CDC's own figures, the death rate of people getting measles was 0.01%. In other words, when you get measles, you had a 99.99% chance you would not die. That's 1 in 10,000. Now they're telling people that it is 1 in 1,000. Do you have any information as to why that would have gone up by a factor of 10 after they started the
Well,
vaccines?
one possible one possible cause might be that back in 1960, most of the people who got measles were between the ages of 5 and 9.
Hmm.
Whereas now we have a change in the age distribution. A lot more of them are infants who are more vulnerable, and they're vulnerable because they're not getting antibodies from their mothers. It used to be, I mean, if your mother had the measles, then she had a lifelong immunity, and she passed this passive immunization onto her babies that lasted for 12 to 15 months. So it got them through the first really rocky period. And the other thing is that a lot of more people are getting it in adulthood. And like
Hmm.
chickenpox, other childhood diseases hit adults much harder. They're much more likely to get the complications.
And of course, that's why they add the adjuvants to try to stimulate an immune response to these weakened or in some other types of